That is, we have two resource personnel discussing on emerging viral infections and new trends, responsibility at first encounter by Dr. Rohitha Muthugala, consultant virologist, and also venous inflammation and implications, clinical management of hemorrhoids by Professor Deepaka Veerasekara, consultant surgeon. To do the honors, with great pleasure, I invite our invitee chairperson, Dr. Senitha Liyanage, who is a consultant in emergency medicine at Colombo South Teaching Hospital, and also Dr. Liyanage is the immediate past president at the Sri Lanka College of Emergency Physicians. And together with sir, I would like to invite Dr. Mrs. Hiranthini De Silva to chair the next session.
Right. As this is a very short symposium, because one lecture, the speak moved to the previous session because Prof. Deepaka wanted to move into the some unavoidable workload. So this is the symposium which standing just before the lunch. So this short symposium will talk the viral infections. We all know we have very high number of viral infections, but surprisingly, that is the infection we manage, sometimes mismanaging. So this is the high time to talk on viral infections. I would like to give the kind introduction to Hiranthini of the Dr. Rohitha Muthugala.
So let me introduce our eminent speaker for today on this topic, emerging viral infections and new trends, a responsibility at first encounter. Dr. Rohitha Muthugala is the consultant medical virologist in the Department of Rabies and Vaccine Quality Control Unit. He is also the head of the Department of Molecular Biology at Medical Research Institute, Colombo. Dr. Muthugala has been a member in a number of respective expert advisory committees such as National Operations Center for Prevention of COVID-19 Breakout, COVID-19 Management Guidelines Development Committee, and COVID-19 Vaccine Registration of the National Medicine and Drug Regulatory Authority. He is also a trainer and an examiner in postgraduate diploma in medical microbiology and MD medical virology. So I think we have an eminent speaker who can speak on this topic and educate on us. Over to you, Dr. Rohitha.
Thank you, Madam. Thank you very much for the inviting me for this presentation. Actually, I think it's a timely topic again. Once again, I think if you went through the news last couple of days, there's something is going on in China again. But according to the Chinese authorities, they say it is due to more cases are reporting due to mycoplasma and respiratory syncytial virus. So we don't need to panic on this one again. So I will give you just a brief overview in emerging viral infections and how the primary care physicians, the family physicians, to contribute, prevent, and tackle with these emerging infections. So these pathogens are with us from the beginning of the human being. So always there are pandemics, epidemics, and outbreaks happen from the beginning of the mankind. But if you went through, for last 20 years, there are many, many emerging outbreaks, epidemics, and pandemic occurs. I think you can see this map. So many areas, so many outbreaks. They go into epidemics, even into pandemics. I think majority has originated near Southeast Asia from China. You can remember last one, SARS-CoV-2 infection, then the SARS in 2003, then a couple of outbreaks of avian influenza, then famous 2009 swine flu originated from Mexico, then the Zika virus in 2015 in South America, then the Ebola outbreak in West Africa, then very recent monkeypox, we call now Mpox, and so many outbreaks. So even this timeline, for last 20 years, many, many outbreaks, and most of them is a public health concern as well. So emerging and reinfection is a major public health problem. It is leading into maybe outbreaks, epidemics, and even to pandemics. Some epidemics declares as a public health emergency of international concern by WHO. Recent one is COVID-19, then monkeypox, the Mpox, even the Zika virus due to congenital anomalies. Then these infections, majority are due to zoonotic origins. The animals are the origin, and the humans got accidental infections. Maybe some pathogens are adapted into human beings and settle in the human community as well. This caused huge mobility and mortality among human population, as well as huge economic impact into those countries because of the travel restrictions affecting tourism, food industry, agriculture as well, and also caused social impact like Mpox, HIV outbreaks of drug resistance. So what is emerging infections? There are a few definitions. One is new disease caused by previously unknown pathogen or new strain of the pathogen. So due to genetics instability of these pathogens, especially viruses, their genome, the virus get mutated and they will come as a new strain or new pathogen. So they can cause new infection among susceptible population because of they don't have immunity. Other thing is sometimes these viruses can cross the species barrier. What's happened in SARS-CoV-2 virus infection. Also, due to various reasons, the infections and the pathogens can cross the geographical regions, and it can appear in the new geographical areas. What's happened in Zika virus infection? Previously, it's known to be causing sporadic infection in Asia. In 2015, 16, 17, it caused a huge outbreak in South America, leading into congenital anomalies as well. Same thing, chikungunya and dengue virus infection due to mosquito population expanding in North America, spread into new geographical regions as well. Also maybe due to increased immunocompromised population, new viral infection emerge in these new populations. Then sometimes disease incident and incidents can cause due to change in the transmission mode or new virulence of the virus or change in the environment. What happened during 2006 chikungunya outbreak? Chikungunya virus adapted to the Aedes albopictus mosquito. Then it spread all over the world. And other thing is some virus, some bacteria can re-emerge. We can control these infections. We controlled it due to vaccination or other control measures, but due to lapse in the control methods or some other factors, appearance of new strains, again these can re-emerge. Now what's happening to measles in Sri Lanka? It's re-emerging again. So why time to time these viruses, bacteria will re-emerge and cause new infection? One main thing is the change in the microbial genome. They can make new variants, new viruses, and sometimes these viruses can cross species barrier and adapt into the human beings as efficient transmission among human to human. What's happened in COVID-19? Then swine flu. Now even drug resistance influenza virus is appearing. So it's a new strain. And I discussed already adaptation to a new vector and spreading the disease. Then due to these ecological changes in the world, due to urbanization, agricultural practice, then the deforestation and reforestation, irrigation things, that there were more human to animal interactivity. So animal viruses can jump into humans and cause infection. And due to agricultural practice, now Sri Lanka, the hunter virus is emerging infection because earlier we used buffaloes to separate paddy seeds. Now we using mechanical farming, the mechanical blowing, so it generates massive number of aerosols and cause hunter virus infection. Then human behavior, the sexual pattern of the human behavior, then the drug abuse, maybe new settlements can cause sexually transmitted disease like Mpox, drug-resistant HIV infections, hepatitis B viral infections, on drug resistance ones. Then technology and healthcare also contributed massively to development of new infection. Because of improvement healthcare, now elderly population has expanded and grown. So elderly population is more susceptible to certain viral infections. Organ transplants using of biologics, then the transfusions cause more survival and more immunocompromised population in some groups. And also sometimes vaccination itself can cause emergence of new pathogens like vaccine-derived polio, maybe appearance of other influenza, Haemophilus influenza bacteria, because we are giving only covering the few strains. The other strains can emerge. Another practice, now international travels are more frequent. So people are mixed together, infection spread fastly from one geographical location to the another geographical location. In food industry, animal trade, and the new sports activities, contact with animals can cause new infection. Then breakdown of public health measures like conflicts, war, then the refusal of vaccination, natural disasters may lead into a emerging of new infections. Then the climate change, global warming has expanded the vector population. Then sometimes can be intentional, maybe bioterrorist attacks. Or now because of this increase this genetic knowledge and the research, maybe people can develop new pathogens, enhancement of pathogenicity. And also very important thing, irrational use of antimicrobial agents. Now antimicrobial resistance is a very big problem. Now this week is antimicrobial resistance awareness week. So I think this is very important for the primary care and the family physicians to consider about antimicrobial resistance. So what is the responsibility of the first contact? I think most important thing, we should be very vigilant on any unusual presentations or presentation of cluster of infections or unusual increase of number of cases coming to you. That may be the first clue of detection of outbreak. So if you detect it early and identify the pathogen, then we might be prevent it, establish in the community, thereby preventing epidemics and pandemics. I think you can remember there was one ENT surgeon has noted there were cases of unusual pneumonia and things coming on Wuhan province, China. They have notified it to the authorities, but authorities did not care on that time. So that may be the first thing. Maybe you are contributed to prevention of pandemics. And during your visits, the patient's history is very important. We have to explore the travel history, contact history, vaccination history, and other activities. And maybe you have to make a background knowledge on what is ongoing on infectious disease outbreaks in the world. Maybe up to date. You can subscribe ProMed or something like infectious disease alert. Then maybe if your patient comes with a travel history, you can think what is the infection going on that area. Maybe that is the first step. You can prevent this diseases introduced into the country. That is very important. Then in the first contact, if unusual thing comes, please wear appropriate personal protective equipment. I think this is good thing we learned from the COVID. Use mask and gloves when you are handling infectious persons. Then the infection control practices, please adhere into that. Then the standard precautions and educate the patient regarding the infection control practices and the prevention of disease transmission to the others, and also proper waste care management. Don't throw those wastes into the normal system. It will be very helpful to prevent and control infectious disease outbreaks in a primary care health settings. Then, if you see something unusual, please inform to the relevant authorities and discuss and encourage the diagnosis and get the experts' advice. So, same thing. We can detect the outbreak early and prevent spread. That will be get a health benefits, economic benefits, and everything. Then another role is always as a legally we are bound to notify the infectious diseases. I think infectious disease ordinance says the communicable diseases they noted, you have to inform them. Other thing is encourage the participation of infectious disease surveillance activities. especially in Sri Lanka. Influenza-like illness. We do the surveillance in the OPD setups, but unfortunately some hospitals, some doctors are not very cooperative on this. They just need to put a tick on the card. It is an influenza-like illness. So we can monitor the trend. It will give helpful when it is next outbreak is coming. These days, measles outbreak is going on. So it's informed to the relevant authorities and surveillance activities. Maybe in future, with good general practitioners and setup, we can expand these surveillance activities into the private hospitals and individual clinics as well. That is an important thing on prevention of outbreaks and pandemic preparedness. Then, during an outbreak or epidemic, we always suggest to follow the guidelines, not the individual guidelines. Because the experts got together and make these guidelines after arguments, disagreements. So guidelines are better than your own thinking pattern, always, because it has some weight on it. And always coordinate effort with the other sectors. Maybe you have to escalate or de-escalate your work. Then always build up the trust, the transparency of the information with the patient as well, and support all the pandemic preparedness and facing the crisis situation, what we did in the COVID. Maybe we have to go for over the phone consultations. Maybe we have to keep some distance and make video reading. So we have to adapt. Other thing is we have to legislation compliance during pandemics. We have to, if it is notifiable, is mandatory, we have to do it. We can't escape even your friend is infected. If you are exposed, you have to be self-assessment and notify to the relevant authorities. The other thing is, please promote only the evidence-based practice, not the myths, what's happened that with Dhammika. So those kind of things can happen again. And even during this Nipah thing, I saw many our healthcare persons also share in the Facebook some wrong informations. So that is very important. Please go through the scientific publications and notes. Please don't take any this newspaper reports or somebody's opinion. And don't share those things. Another thing is very important in prevention is promote vaccination. I think you know these days measles outbreak is going on in Sri Lanka. More than 400 measles positive cases reported. More than 90% of them are unvaccinated. So there's a vaccination refusal is coming up in certain population. That is maybe a big problem in future. Because we are here because our parents accept this vaccination. That's why now measles, polio, rubella, those things are disappeared. But this will be a problem in future. And please, dissemination of correct information and health education for your patients. Then another important thing, travel medicine. Maybe patients will come to you getting advice regarding the travel and after coming from this travel. So what are the diseases prominent on that region is going on? What are activities they are going? So you can promote the vaccination, then the prophylaxis and health education. And also very important thing is rational use of antimicrobials. Because in future, maybe the resistant bacteria will be the silent pandemic in the world. It can cause massive problem in future. Because always try to whether this antibiotic is required. Because majority of the infections are, especially respiratory things, are viral. So no need of giving antibiotics. The other thing is Tamiflu. Now it's oseltamivir. Is now going misuse. Even now it's available in the over-the-counter. So in future there will be no drug for influenza if it is new pandemic comes. So we have to preserve those things. So that is a very important things as a family physicians, primary care physicians, so we have to think about it. So thank you. It's a brief presentation, but I try to give you enlightenment on how to prevent and how to tackle these emerging infections. Thank you very much.
Thank you for that informative lecture, Dr. Muthugala. and highlighting the responsibility of primary care physicians when encountering emerging viral infections. With the interest of time, we have one question.
A very short question, Dr. Muthugala. Just to ask, is there any flashcard or some pocket guideline kind of thing, the do's and the don'ts in the viral emerging infections, which we can disseminate among our primary care physicians? Because physicians, we don't want to go lengthy guidelines, and also the absorption also very not that optimal.
Yes, I think that will be a good option. Maybe next time with the outbreak of pandemics comes, so we can work together and make those kind of smart things, small flashcards, maybe a mobile app. Last time I think we developed some guidelines, but it took, it's a guideline, it's a big one, as I agree.
Any other questions from the house?
Thank you very much for your nice presentation. And you mentioned there's a measles outbreak. And could you please tell us what's the age group, you know, what sort of people and epidemiological factors?
Right. Actually, more than 90% were unvaccinated. It's belonged to a certain ethnic group who were refusing the vaccination. Actually, 90% of them are unvaccinated children. So there are young adults who had a 1 dose of measles vaccine also has infection, and also babies less than 9 months has few cases, but 90%, more than 90% are localized to certain areas in the country, was unvaccinated. Actually, you may be surprised to see they were not even vaccinated BCG before sending the home.
They have only limited to a certain area.
Certain areas, a certain group.
Okay, right.
Now the epidemiology unit is trying to access those groups through their religious leaders, but 90% of them are unvaccinated. So around 360, 400 children unvaccinated for measles is a bit of alarming.
But you know, it's all of a sudden what happened, because it was like there for some time, you know, the measles vaccination. Why they have stopped giving the vaccination? There should be some reason behind this, I suppose.
Not giving vaccination, they are refusing.
Yeah, that's what it is. Earlier, of course, they have gone for the vaccination. All of a sudden, it's changed, you know.
Maybe this accumulation of their beliefs, or maybe some, what it called, they are
anyway, we had to find out the actual reason behind this.
Actually. Maybe they are having some their own ideas. They refusing to take the foreign protein into their bodies, like that kind of arguments. They going to use it. That's the thing.
Okay, thank you very much.
Okay, because of the time factor, I think this is the time to wrap up our symposium. Before the wrapping up, I would like to invite Dr. Muthugala